Hello, my name is Nettie, and I had the VASER Lipo 360. Well, I heard about Dr. Satey. His auntie, of course, owns a store in the mall, and I own a restaurant across the street from the mall. And we was having lunch at the same place, and she told me about her nephew, and I said, "Well, let me go over here, because I like to keep things in the family." So I came over, and I was blown away by what he showed me. He showed me the before and after pictures. When I sat and I talked to him about the things that I was insecure about my body, he was able to break it down for me to where I felt more comfortable. He allowed me to I said, "Okay, well, let me think about this," and then I went back to him, and it just felt like a place at home, a person that I would trust. The trust was number one. Well, I had felt that I just wanted to maintain my weight and shift it. I'm 60 years old. And so I just wanted to shift everything and be able to maintain it, because the older that I get, I know the weight sits and is stubborn. And I wanted to fix that area and maintain those areas so that I could look better in my clothing and be healthier. Look better, to feel better, to have more energy. It's like a light turned on. The surgery made a light come on for me. It just made me feel like I want to get dressed. I love to get dressed. It just gave me some snap. It gave me some energy. I don't feel bloated. I don't feel like it today. Every day, I just want to get dressed. I just want to be in the mirror. I am just a beautiful Black queen, okay? Loving it. That's it. That's why. My greatest fear was that that it couldn't happen for me. I've seen things. I've had a surgery before, and I had scar tissues, and that was the hardness of that. And I just didn't want to be a story where it couldn't work for me. I didn't want to be lumpy, and I didn't want to feel knotted. I didn't want to feel hard. I wanted to be natural, and that was my biggest concern. And then what was going to happen afterwards, the aftercare, the scars, those, as a woman, I want to be able to take off my clothes, and I don't want to be insecure about the scars. When I came out of surgery, I went to, the nurse came and did the care. I paid the nurse care. That was really essential, because I was lethargic. I didn't know that the pain was going to hit me. I didn't know when the pain was going to hit me. But getting up, feeling the pain, the staples, the stitches, I'm not sure if it was staples or in stitches, but it felt like it. It felt, it's like getting cut, getting numb, and you're not realizing that it's there until you move. Moving I was glad that we had the consultation, because he told me what to expect. But I didn't expect to see it that soon. I didn't expect to feel it that soon. Within those first 24 hours and first 48 hours, that is when, changing my clothing, that was where the realization that I had surgery. But I was able to make it through that. It wasn't like something that I had to have any medication for, extra. I didn't have to do any extra. I'm not a wimp. I tell myself, get up, girl, you can do this. Get up, and snap yourself out of it, And I was able to push through it. And I was able to come to the doctor's office and let him know what I was going through. Was it worth it? And I feel like I made a mistake, or feel that I did something wrong. And then we was able to look at the results, baby. Girl, let me tell you, looking at what we did, looking at what I went through, looking at the results of how it came out, looking at what it was for, it was well worth. It was the pain versus the result. The result outweighs the pain. Surgery impacted my life emotionally, because I didn't feel pretty in those areas. I didn't feel, I don't have to overlay clothes. I was overlaying clothes. I was overdressing. I would put on things to squeeze myself, and then at the same time, I would put on stuff to drape myself. So now I don't have to triple layer my clothes. That emotion, going through that stress, was laying out those clothes. Baby, I like taking off my clothes. I like clothes less is best. Emotionally. Spiritually, I mean, I'm grateful. I'm grateful to be at this position at this time of my life. I'm grateful that the doctor that I have was skilled and specialized in the surgeries that was performed for me. He was skilled in knowing, as a Black woman, to work on Black skin. That was amazing. What he did was amazing, because women like me usually don't come in and get treatments like this. So I was grateful to have a doctor that cared about what he was doing, that specialized and gave me choices. He said, well, we can do this, or you can get with this, or you can get with that. That's what he said to me. And that what made me feel spiritually that I could trust him. And he was a man of God. We prayed in the room before we did surgery. We prayed in the room every time we come and talk about spiritual this and spiritual that. So that made me feel more comfortable knowing that he has somebody over him. He's the man, but he had a man over him. And that just made me feel even better. And now emotionally, just look at me. I'm just, I'm just popping. Everything is just good. Everything is just, I don't have a side effect. I don't have a side effect. And every medicine that I've ever taken and anything that I had to do, I had to have a side effect to it. And this, I can say that I don't have a side effect. So spiritually, mentally, emotionally, financially, I'm even better as well. I would suggest for them to come and get a consultation. Realize why you're doing it, why you want to do this. And you have to not just want to do it because you want to look better. I don't think that is a reason enough. I think you need to go to the gym for that. But if you want to do something that would extend your horizon, extend your, I would say my life, it did save my life. It extended me to where the extra fat, not just, I didn't want it to be moved from this place and put in another place because I felt that I was still carrying it. But it just made me feel tighter. It just made everything in my areas of my life feel tighter. And I'm a person that likes to be punctual. I like to be tight. I like to be, clean. And it just made me feel, I would suggest a person would come in and talk to the doctor. And if you have a to-do list, this would be one thing that you would put on it. This would be the to-do list, to come to Dr. Satey and talk to him and say, this is something I would like to do. And he can break it down for you in increments. I mean, down to the centimeter, down to the millimeter, down to every, fiber, that he would explain it to you of why this should be something that I think every woman should do. Come be pretty, prettier. It makes you prettier. It tightens you up. It makes you stand taller. It put an arch to my back and make my shoulders, go back, my head go up, and I am just fabulous. Thank you. Thank you for making me feel welcome and making me feel at home. Thank you for the peace of mind. The nightmares that I was having before I got here, I can actually say to you that they're gone. The nightmares that I had when I would think about getting dressed was a stress that has been gone. It's gone. It's no longer there. Thank you for making me feel beautiful. I was pretty, but now I feel beautiful. I look in the mirror and I can do a 360, and I am satisfied with the surgery. I'm satisfied with the team. The team have shown me love. The Dr. Satey has taken my phone calls when he was like, well, I'm in surgery right now. I'll call you right back. He actually picks up the phone. It's not like I'm calling an answering service and I have to listen to a voicemail. I felt that they took something personal and private and made it special for me. And I have known to him to do this for all of his clients, all of his clients. He would take out time and he would say, I'll be right back. I'm talking to you. I'll talk to you. And he would send a team member in to just keep me company till he get back. And that's what made me feel like family. Everything was like family, all the way down to the massage, all the way down to the anesthesia, all the way down to the nurses that come in the room, all the way down to when I make my appointments, all the way down to, the doctor would come and share a prayer with me. I would say, let me read this to you. He would take out time. I know that he's a very busy man, and he would take out time to listen to my prayers. He would take out time to if I'm feeling uncomfortable, that is love. He showed me love, and everybody needs love. And this is where you come and get a hug. You get a hug spiritually, mentally, emotionally. You will get a hug. And financially, because the money that was spent was money that was well spent. So it was financially as well. And it was like, I'm gonna cross my fingers like this, and I will send you a long distance hug. And I want you to take this hug with you everywhere. And we're gonna go like this, and we're gonna hug it real tight, and we're gonna be able to hug each other from a distance. And I appreciate you